Hello, my name is Dr. Nally. I'm a board-certified family physician and a board-certified obesity medicine specialist, and I'm currently in Austin, Texas at a medical conference, at the Ketone conference that starts tomorrow. And I've had a number of questions over the last 2 weeks come up about metformin. There's a couple studies that have come out recently about metformin and its use with ketogenic diet, its use with exercise, with diabetes and things like that. And I've had a lot of people asking some questions. So I wanted to try to clarify some of the information about metformin, how we use it in the office, what I would recommend people consider, and how to talk to their doctor about the use of metformin in regards to blood sugar control, exercise, and losing weight in that capacity. So important to understand that. Let me put up on the screen who I am. My name is Dr. Adam Nally. I'm a board-certified family physician and obesity medicine specialist that's been in practice for about 20 years. I've been specializing in using ketogenic lifestyles for about 15 years in my practice with both myself and with thousands of patients. And so I wanted to give you a little information there. I've got a little bit of a time delay with my software on Facebook. This is rolling live to Facebook right now. So good evening, you guys, as you sign in. If you're new to the broadcast, please put a 1 in the chat box and then let me know where you're from so I get a feel for where people are coming in from. But I'll try to answer some questions toward the end of this. I just want to give some brief information. This is fairly basic and it won't take too long. First off, metformin is a great medication, and I use it with hundreds of patients in my practice. I should probably say thousands of patients. It's a drug that's called a biguanide that was designed to help the liver handle blood sugar more effectively. And it's got a number of processes that work within the liver, some known and some unknown. But it's been around for many, many years, at least as far as I know, about 20 years that it's effectively being used for diabetes. The nice thing is it's a generic medication. There are some side effects to metformin, though. Those side effects can be stomach upset, nausea, and even diarrhea in about probably 10 to 15% of patients that use it. There are some long-acting forms that are less likely to cause those symptoms. But one of the amazing things that we see about metformin is that it helps the body handle both the insulin and the processing of blood sugar more effectively, and helps to maintain the blood sugar by decreasing the overall hemoglobin A1C, which is an average blood sugar measurement that comes out as a percentage, by up to 2% in many people. And so I like it as a physician, a family physician. I think it's a wonderful medication that's effective for control of blood sugar in my type 2 diabetics. It can be used in combination with other medications as well. It does have some effect in both the liver and the kidney. So if you have liver disease or liver damage, or you have kidney disease or kidney damage, you need to work closely with your doctor about whether metformin is the right drug for you. And I'd highly encourage you to talk with your doctor about the pros and cons of using metformin in that regard. The question has come up recently about whether metformin should be used for longevity. And there's been some studies that have shown that metformin does have some lifespan enhancing properties that are affiliated with it. And so a number of people who specialize in longevity are using metformin as an adjunctive to try to extend lifespan because of its effect on the overall blood sugar. A more recent study that came out this last month talked about the use of metformin with exercise. We know that exercise has a longevity effect as well. So if you're exercising regularly, it actually will increase longevity, decrease the aging process. And metformin's been shown to do the same thing. What they wanted to look at is what happens when you combine metformin with exercise together. Now, one of the properties that metformin has in its ability to control blood sugar is it actually slows what's called mitochondrial respiration, meaning the transport of oxygen in the mitochondria. Mitochondria is kind of like the carburetor for the cell, and every cell in the body has one. And metformin slows that down just slightly. The problem with slowing that down is that if you're participating in activities like exercise that have increased stress response, that mitochondria doesn't handle the stress as effectively. And what we find in the longevity studies is that if you're adding exercise in with your metformin, the metformin becomes less effective, and the person may not be able to achieve exercise capacities, especially with endurance and long distance type exercise. Now, does that mean you should stop your metformin? And the answer is no. You should talk with your doctor about it. But if you've started an exercise program and that exercise program is being used to help control the blood sugar, you're going to want to watch closely to see how are you handling the exercise, how's the blood sugar doing, and can that metformin be reduced or changed to something that's more effective that allows you to use exercise. Now, is exercise as effective as metformin in lowering blood sugar? In my clinical experience, not always, but I've had some patients that are very successful with both dietary change, especially with ketogenic diets, and the addition of exercise. They've been able to come off their metformin once they get those blood sugars under control and their insulin resistance improves. We know that exercise improves the the sensitivity of insulin at the muscle cells. And metformin has a similar effect, but when we combine the two together, because of the effect that metformin can have on the mitochondria, it can negate a little bit of the endurance capacity or mitochondrial respiration in the cells throughout the body. So it's kind of a balance. And so the longevity folks have been looking at this and saying, well, maybe we shouldn't be using the two together. What I want people to understand is that that's an off-label approach and use of metformin. It's not something that I usually deal with every day in my clinic, but it's something that we do talk about with some populations and some people. For the average person who's using metformin because of diabetes, you don't want to just suddenly stop it. You want to work with your doctor very closely about the use of metformin and how it works with the muscle cell, how it works with the liver, and how your blood sugars are coming down. What I commonly find is that if a person institutes a ketogenic lifestyle, they can often lower their blood sugar enough by 2 to sometimes 4 percentage points on that hemoglobin A1C level to where they may not need the metformin, or they may only need a very small dosage of that metformin as that insulin resistance improves. In my clinic, I clinically see that it takes about 18 to 24 months for insulin resistance to improve with the use of a ketogenic lifestyle and or exercise added into that. And that exercise is both resistance type exercise, so whether that be weightlifting, yoga, Pilates, things of that nature, and or high intensity interval training, which they call HIIT training, HIIT training, which is not just running or cardiovascular exercise, but it's cyclical intensity exercise with cardiovascular exercise combined together. And we find that the two of those together have a very effective improvement in overall insulin sensitivity and may be able to decrease the need for metformin generally. So what a lot of people have asked is, well, should I just stop my metformin because it's not so good for me? And the answer is no. Your metformin is doing a job and it's playing a role. And you want to talk directly to your doctor about how long to take that metformin for, what cutoff point you would say, okay, now it's time to stop the metformin or decrease the dose of that metformin. And that's something you want to work with your doctor individually, because each of us are individuals. We will respond differently to exercise, the type of exercise, the type of diet we're following. And so it's important to understand that. From the perspective of longevity alone, if you were using your metformin in regards to just helping with longevity and blood sugar was not a problem, then what the data is telling us is that using the metformin combined with exercise may not be as beneficial. What we don't know is the active ingredient in turmeric is called berberine. Berberine has a very similar effect to metformin, and what we don't know is does berberine do the same thing? And that's also something that we need to look at further in the sciences. So there's still some questions that arise in regards to, do we use the berberine with that continued exercise, or should you use the berberine mainly just with your evening meal after exercise, when that exercise window isn't going to occur for the next 8 to 12 hours? Those are still unanswered questions. But for the average person using metformin, hopefully that gives you some answers, and hopefully that gives you some clarification. Again, my name is Dr. Adam Nally. I'm a board-certified family physician and a board-certified obesity medicine specialist. I've been in practice about 20 years in Surprise, Arizona. That's a northwest suburb of Phoenix. And I've been doing ketogenic lifestyles with thousands of patients over the last 15 years of those 20 years in practice. I'm going to try to answer some questions here. I know a bunch of you signed on. I appreciate you signing in. Does berberine, let me see, the questions are coming in fast. Let me ask. My doctor knows I'm doing keto and does not want to do any blood work for another 4 months. Blood sugars have been wonderful, hoping to stop some medications. Remember, metformin, the A1C test is an average over 3 months. So we check that every 3 months. Checking it sooner really doesn't tell us what your average falls out at if you do it sooner than that. So that's probably why they want to wait 3 or 4 months in that regard. So I understand that. That's pretty clear. What's the therapeutic dose to use of berberine? Well, in regards to the use of berberine with polycystic ovarian disease and improving with weight control and blood sugar control in patients with diabetes and PCOS, we found that 500 milligrams of berberine seemed to perform equivalently to 500 milligrams of metformin without as many side effects. Now, what we don't know is, does it still have that same mitochondrial uncoupling that metformin does in the liver and the other cells of the body? And so that's a question that's still to be answered. But I find that from the perspective of weight loss, and blood sugar control, I'll use berberine 500 milligrams 3 times a day in place of metformin 500 milligrams 3 times a day, and it seems to work really, really well with those patients that I have using it. And I find that it's helpful in regards to improving symptoms of polycystic ovarian disease, as well as the blood sugar control and weight loss. So that's what I find is really helpful. Hopefully that answers that question. Thank you, Sheena. I appreciate that. I'm going to try to catch some of the other questions here. Does berberine work similar to metformin? They work almost identically, but berberine doesn't seem to have the side effects of stomach or GI upset, stomach upset, diarrhea that metformin does. And so I find I use berberine twice a day myself. I'm running a little bit of an experiment with myself right now, seeing if I skip the berberine in the morning when I'm doing my exercise, do I seem to perform better? And so that's one of the little experiments I'm running on myself. Hopefully there may be some studies that come out later to give us some information about that with berberine, but I don't know if it's in the pipeline right now. What about berberine as an alternative to metformin? I do exercise, but after a year of keto and fasting, sugar is still high. It's come down a lot, but not there yet. Remember, Ingrid, it takes about 24 months for insulin resistance to improve. We find that exercise plays a big role in that. So if you can institute an exercise program, especially resistance type exercise, 3 days a week, that's going to be really helpful. I've found that in my clinic that the addition of berberine twice a day, one with breakfast and one with dinner, or one with lunch and dinner, however you're eating, and then using it with exercise is actually really effective in that regard. So yes, that's the answer. But again, in regards to high intensity exercise and some of our elite athletes and their ability to increase endurance capacities, does the berberine affect that? We don't know the answer to that yet. So hopefully that gives you some information there. Pardon me as my phone is pinging at me. Let's see. I think my hormones are out of whack and I'm not losing. Deanna, we need to have somebody check them out. So go see your doctor about that. That's important to look at. Let's see. Jonathan's signing in from Brisbane, Australia. Paul says, how's Austin? Austin is actually, it rained cats and dogs for about 3 hours here. And it is humid as can be. So it's hot like Phoenix and humid together. And I went outside and was sweaty bullets. Had to change my shirt when I came in. Lois says, I appreciate you take questions at the end. Well, thank you, Lois. And hopefully I get to answer as many questions as I can. Generally, again, I'm not giving medical advice. I'm just answering general education questions. And you need to take any medical question directly to your doctor. It's important that we clarify that for you. I don't want to be giving you medical advice. That's not what I'm trying to do here. I'm just trying to educate about some concepts regarding the science that's publicly been made aware of and people have asked me about. So I want you to take your individual question to your doctor. Hello from Northeast Texas, says Martha. Hello, guys. How are you? Everyone's signing in from all over the place. That's wonderful. Let me see. Let's see. Is Jardiance okay to use while doing keto? I am not a fan of SGLT2 inhibitors with keto, and let me explain why. Jardiance is an SGLT2 inhibitor, and what SGLT2 does is it actually shifts downward the glucose curve, so it actually lowers the glucose level that your liver normally tries to keep that range in. So let me clarify a little further. The liver attempts to keep your fasting blood sugar somewhere between 70 and 100. The SGLT2 inhibitors like Jardiance, Januvia, Invokana, these actually shift that blood sugar level lower. Now the problem is that I've had 3 or 4 patients with ketoacidosis when they do a ketogenic diet using these SGLT2 inhibitors, and because of the change that occurs in that glucose and the shifting downward of insulin. Insulin acts like a brake. If you're producing insulin, even large amounts of insulin is the brake that prevents a person from going into ketoacidosis. It plays a role in that end as well. And so if you shift down that graph, there's a potential chance that you can actually cause ketoacidosis if you're doing a ketogenic diet. So if you're doing keto, the one drug that I do not recommend you use is an SGLT2 drug for blood sugar control. In most cases, you won't need it because the keto will solve the problem. But if you're on one of those drugs like Jardiance or Invokana or Januvia, Invokana, Jardiance or Farxiga, then you want to talk with your doctor very closely about the risks associated with doing keto. That's the one drug that I would be very cautious in doing keto with because of the problems that I've seen happen there. So I'd say be careful in that regard and talk with your doctor about trying keto without it if you decide you want to do that. But that's something you need to talk directly with your doctor about. Tuning from Down Under, great info. Well, thank you very much. I appreciate that, Stephanie. I'm off my insulin and only on metformin once a day. Will this lower your A1C? Yeah, it will. Yes, and that's congratulations. That's amazing. We love it. I love it when I can lower people down to once a day with metformin, and I do that a lot of times with people. It went from 11 to 6.4, which is fantastic. Adding a little exercise in there, if and where you can, will actually improve that even more. And so, give yourself time again, 12 to 14, 24 months to get that to improve is what I commonly see clinically in my office. So work closely with your doctor about that. But congratulations on that, Christy. That's wonderful. How do I feel about Victoza? I think Victoza is a wonderful drug. I think it works phenomenally well with a ketogenic lifestyle and diet. I like it a lot. It's a once a day. Victoza is a GLP-1, meaning it stimulates a longer acting form of the hormone that's released from the gut when the gut stretches and makes you feel full. So it actually decreases your appetite. It actually decreases your blood sugar, slows the transit time of food through the gut. So it's a little bit slower. The blood sugar doesn't rise as fast. So it's actually a really effective medication. And I use it with a lot of my type 2 diabetics, and we see great effect with it in that regard. So I'm a big fan of that one. Hello, neighbor, originally from Metorma, Ohio. Cool, Jamie. Hello. Victoza. Oh, I just answered Victoza. Just on Victoza, stop the metformin. I have some patients, Cathy, that we do that with. We were able to back off the metformin and just use Victoza alone. I think that's fantastic. There's another drug out called Ozempic, which is once weekly, a cousin to Victoza. I like it as well. There's a couple other GLPs out there that work really well. Very effective in that regard. Will berberine help with cravings and hunger? Yes, it does. That's one of the benefit of metformin and berberine is there is some appetite suppression associated with them. Doesn't happen to everybody, but it's actually really effective, especially in a ketogenic lifestyle. I find that berberine is really helpful in regards to suppression of appetite. Can you use berberine in addition to thyroid medicine? Yes, you can. I use it with people all the time, Linda. It does not seem to interfere with thyroid at all. When using intermittent fasting and only one meal a day, do you find one dose of berberine just before the meal is sufficient? I find that's the only time you should take berberine or metformin. Both of these drugs really are most effective when you take the meal. If you take it separate from the meal, it can give you stomach upset. And I've had berberine on an empty stomach give people diarrhea. So you really want to use it with a meal. Remember, berberine is the active ingredient in turmeric, and turmeric is an herb that we use with our food, and it actually inhibits or slows the uptake of glucose and the use of glucose, and it enhances the way the body handles the insulin within the cells at both the liver and the muscle cell. And so it's a very effective method of improving glucose control. And so I would say, if you don't eat the meal, don't take the berberine or the metformin because that's really how these medicines work. They work with a meal. So if you're using it one meal a day, then just use your berberine at that one meal. That seems to be very effective in that regard. What benefits to taking berberine on a ketogenic diet if the glucose is around 100 most of the time? Sorry if I answered this. So to be honest, Brian, great question. I would only really truly recommend berberine or metformin. Let me back up. We use metformin for our diabetics, and so if your blood sugars are commonly over 126 fasting or above 200, then metformin is really going to be the drug that's more effective in that regard. If you're borderline, you mean you're insulin resistant or you have impaired fasting glucose, but you're not truly diabetic, berberine is really effective, and berberine works really well. If you commonly have fasting sugars under 100 and you don't normally see them go over that, I don't really think the berberine is really that important. And there's still some argument whether is the berberine going to improve longevity, or is it going to, does it help with the insulin resistance even further? What I find is that if you have blood sugars that are normal under 100 fasting, you probably don't need either of them, and you do very, very well that way. Really, the berberine is most beneficial for the use of for controlling the abnormal sugars that are not quite in the diabetic range, if that's effective, if that is clear. For people who have normal sugars that are doing a ketogenic diet, a little bit of turmeric here or there is going to be great because it has an anti-inflammatory and an anti-glycemic effect, but not nearly in the doses that berberine would normally, because berberine is isolated isolated chemical from the turmeric. So using a little turmeric 2 or 3 times a week really is going to be effective in that regard. And if you don't have insulin resistance or impaired fasting glucose, I'm hoping that answers those questions. Good evening from Cincinnati. Very interested in this topic since I've been on metformin since you're diagnosed in November. Lowered the A1C to 5.6. Congratulations, that's awesome. And now 5.0. All due to ketogenic diet and exercise. If it is this low? Do I still need to take it? My doctor said we'll be on metformin and lisinopril for life. Again, that's comes down to you and your doctor, and really not seeing your lab work. It's hard for me to I can't comment on that. If it were my patient and they had lowered their A1C to under 5, like around 5.0, you're now completely within the range of non-diabetic. What I would do is with my patients is run a little experiment, take them off the metformin for 3 months, and see how they do, and see if that A1C goes up. In most cases, the A1C doesn't, because they're not getting any additional benefit from berberine in that regard. And so that would be something to talk with your doctor about. Maybe see if your doctor's willing to do a little experiment with you to try to wean off that metformin in that regard. But please still don't do this just on your own. Make sure you're talking with your doctor about it, because there may be other things that your doctor's wanting you to use that metformin for, that you want to talk with them about. So hopefully that answers the question. But many of my patients that drop their A1Cs under 5.6 no longer need that metformin. And when we stop it, if they're maintaining their diet and their exercise, specifically a ketogenic diet, that metformin is no longer necessary. So a very good question. And this is where those questions have arisen, is that people are saying, hey, what do I do with it? But great question, Denise. Let's see. I think I caught all those. Why does increasing magnesium help with constipation? Well, magnesium actually is a natural laxative, and that's why it actually stimulates bowel function and movement. So hopefully that gives you some clarity there. Let me see if there's any other questions. Best place to buy berberine? Well, Shari, I actually designed my own berberine supplement, and it's at ketoliving.com. We actually combine it with chromium, which also helps to stabilize blood sugar. So I'm kind of partial to my own supplement, but you can find berberine just about any health food store that's around, in a 400 or 500 milligram dosage. Ours is a 500 milligram dosage that you take two or three times a day, but it's got additional chromium, so it's called Berberine Plus. You can find that at ketoliving.com. If that's the source that we use in my office. But like I said, if you find a good source, I'm not partial to that. Let's see. Where do I buy beef, or do you raise your own? Well, if I can buy grass-fed beef, I do. I have a brother-in-law that has some cattle, and so sometimes we'll buy half a cow from him. But if we're in a bind, I buy my beef at Costco or Sam's Club. Is it always grass-fed? No, it's not. Am I anxiously worried about that all the time? No, I'm not, because cost plays a big role. And so, like I talked about the other night, if you're having processed meat as your source of protein and fat, great. I'm not worried about it. If you can do it, you're always going to be better off, because the omega-3 fatty acid content is going to be better if your beef is grass-fed. But if you can't afford it, or you don't have access to it, don't stress about it. Don't worry about it. My total cholesterol is 386. LDL is 268. Should I worry? Charlene, you need to go to YouTube /Dr. Nally. Go to my YouTube channel. That's youtube.com/Dr. Nally, and watch the total cholesterol video I did there. That'll answer those questions for you. Did a whole video on statins. You guys are very welcome. Yes, it's hot and humid here in Texas, but it's fun to be here. So let's see. How can you determine how insulin resistant you are? You actually need to have your insulin levels tested. And I do that in my office, Linda. That's something your doctor can do as well. Is fat in the coffee enough to take metformin? No. Remember, metformin is going to help your body handle glucose and carbohydrates. Fat is not a carbohydrate, and so fat in your coffee really does not enough to really take your metformin with. I don't recommend that to my patients. All right, would metformin and berberine be good for fatty liver? Now, remember, you don't want to use metformin and berberine together, because they inactivate each other. So you either use metformin or you're using berberine. You don't want to use the two together. And if you're an endurance athlete, the whole reason this whole conversation started was, should you be using metformin and endurance athletics, right? Endurance training? We're finding that the metformin negates the ability of some people to improve the endurance capacity in that regard. And so if you're not using metformin for blood sugar control, then in that case, you also probably would not want to use metformin if you're doing lots of high intensity exercise and you're trying to use exercise as your method of enhancing your cardiovascular stamina. All right, I hope that caught all the questions. You guys have some good questions tonight. Yes, Cheryl, I know people talk about grass-fed, and to be frank, if you eat a grass-fed steak out of the Midwest, the omega-3 fatty acid content's identical to a salmon that comes out of the ocean, and that's why it's so important to understand is that we've decried beef and said beef's so bad, but if it's grass-fed beef, your salmon and your beef have the identical nutrient values in them. When the beef is not grass-fed, that omega-3 goes down and the omega-6 goes up. But my concern is that not everybody has access to that, and sometimes it's really costly. So my suggestion is do your best. And if you don't have access to it, it's too expensive, don't worry yourself about it. If you're getting, your good fats through butter and, real food like beef tallow and other capacities or bacon fat, things of that nature, then you're fine. And I'm not worried about it. Should you take metformin on a carnivore diet? Again, Laura, that's it's not gonna hurt you. But again, what's the reason for taking the metformin? If you're diabetic and you institute a carnivore diet, then we want to just closely watch those blood sugars and see, will you still need that metformin over the next 1 to 3 months? And what is your blood sugar doing? And do you still need it? Remember, insulin resistance, in my perspective, with my clinic patients over the last 15, 20 years, it takes about 24 months to improve that insulin resistance. And so with my patients that are doing keto or carnivore, we'll continue using that metformin for 1 to 2 years. But we usually are weaning the dose down until we can either get rid of it or we use a much lower dose as a baseline, depending on where they're at in their overall genetics. Sharon says, how do you feel about taking collagen? I think collagen is just buying someone's boat, to be frank. If you're using real meat, real food, and you're getting real, the gristle and the thicker fat that's on your steak, that's collagen. So one of the reasons I smoke meat a lot is that my wife hates the gristle, but when we smoke it, it actually tenderizes that so it doesn't taste bad, and you're actually getting the collagen from that. So you can buy really expensive collagen out of a powder bottle if you want to, but it's real high in amino acids, especially those that can raise insulin and those that are insulin resistant. That's been my experience in my clinic, that people using a lot of collagen powders, their blood sugar creeps up, especially if they're diabetic. So if you're using real food, real steak, you're going to get all the collagen you need. Save yourself your money and buy better bacon or better beef instead of collagen powder. I know I'm too real, aren't I? Let's see. I'm new to this. Can you explain what is berberine? What are the benefits of it? Esmeralda, go back and watch the beginning. Again, berberine is the active ingredient in turmeric or golden seal. It's been isolated and concentrated, and it has an effect similar to metformin. But go back and watch the rest of it, and it'll explain it to you. In what way? Linda, I'm sorry, I missed. I'm not sure what question you're asking in that. Let's see here. So you say it takes 24 months to improve insulin resistance. What would that explain the ongoing sweet tooth cravings for carbs? Yes, it actually does, Kathy. I mean, remember, I see people who come into my office with a fasting insulin of like 38. And fasting insulin, in my perspective, should be less than 5. And it takes anywhere from 18 to 24 months for that fast insulin to slowly creep down, as the fat cells shrink, as we become less and less insulin resistant. Remember, the insulin resistance is driven by the oversized fat cells that are overproducing hormones, stimulating the liver to keep the blood sugar too high and causing the pancreas to have to overwork. As the fat cells shrink and as the fat cells heal, we become less and less insulin resistant. And that can take anywhere from 18 to 24 months for many people. The leaner you are, the faster that process improves. That's where exercise plays a role, because exercise drives that process faster as well. So if you can exercise, and many of my patients can't because of severe arthritis, or they use walkers because they're in their 80s, but whatever you can do is going to be beneficial. So hopefully that's important. My website is docmuscles.com. Go check that out, Catherine. You can see it there. Let's see here. Lower insulin levels with weight loss, easier menstrual cycle. Yes, it actually does do that. I don't know if that's a statement or if that's a question there, but yes. Let's see. Could weight loss remain slow while insulin resistance is healing? Yes, it can, because it takes a while. That's where you're seeing a lot of plateaus. That's why I have a lot of patients that plateau, because those fat cells it takes them a little while to shrink. They have to lose the fat. They have to rebalance out their body water that's throughout the body and in those fat cells. And so that's why you're hitting plateaus. But you just have to be patient with it. Just keep plugging away. Keep esterifying is what I tell people. Just keep hammering on it. That's important. Does Advil kick you from ketosis. Non-steroidal anti-inflammatories have a dampening effect on the ketogenic effect. And so, yes, if you're doing a bunch of Advil, you may have a harder time getting into ketosis. You are very welcome, Cathy. My hope is that you guys get some good information, that I can dispel a bunch of myths and a bunch of crap that's out there with a bunch of supposed keto experts that think they know what's going on. I'm going to tell you what I see in my clinic. That's really what I'm going to tell you. I'm going to tell you, I've been doing this for 20 years, and I've been treating patients with ketogenic diets, myself included, experimenting with myself for 15 of those 20 years. And so I see a lot of stuff, and I just want to make sure people understand from a nutritional perspective what truly does a ketogenic diet do, how can we use medicines appropriately with it, and give you and my patients that are watching this some insight. This, I do these really so that I can point to my patients and say, hey, go watch this video I did here. That'll just give you some more insight and answer those questions. So I hope you guys get some if you get value out of this, please share this with your friends. I'm going to roll this over to YouTube, so it's on YouTube. So share the YouTube video if you would. If you want to be a Patreon and sign up for that, that helps me be able to have more time to make these videos for you guys. So keep up the good work. Check out my blog at darkmuscles.com/blog. Check out the YouTube. It's youtube.com/Dr. Nally. I'm Doc Muscles all across the internet. So if you type in Doc Muscles, you'll find all my stuff. Have you heard of someone ending up on dialysis after keto? I have some patients that did keto, but their kidneys were so bad off they ended up on dialysis. The dialysis does not. I have yet to have a patient do keto that does not improve their kidney function. A ketogenic diet done correctly improves kidney function. In fact, I've done a whole video on that and how it helps on YouTube. So go check that out as well. It's pretty cool. Thank you, Teresa, for telling people about my book. Thank you. It's The Keto Cure. If you haven't purchased it, go to Amazon.com and get your Keto Cure. You can get a signed copy from me if you go to my website at darkmuscles.com. We'll send you out a signed copy. I'll sign it just for you. And you were the first to explain insulin resistance and weight loss effect. Thank you, Lisa. That's very kind of you. I hope that's yeah. And yes, Cheryl, I am at KetoCon. If you're here at KetoCon, check me out, find me and shake my hand. I'd love to meet you and hear your story. How often do I go live? I try to go live. I've learned more in 10 minutes than really a worth in a month. Thank you, Catherine. That's very kind of you. I try to go live at least once a week. And if I do go live, I'll try to roll those over to YouTube so that they're recorded. Sometimes I go live every day. Sometimes it's once a week. My schedule's busy. I'm a father. I work literally 18 hours a day in the office. I work in the office and I come home and I work on charts for hours after that. Talk to my wife and she'll tell you the story about being a doc. But I find that this is actually, I love doing this. This actually brings me great joy to help people with their nutrition because it means I have to give you less pills, and it's always exciting in my office to stop a pill. I think if you're a good doctor, you're teaching people how to use less medicine, and so that's kind of my goal, is to help everyone, as many people as I can, use less medication and realize that just as Hippocrates said. Let food be your medicine, let medicine be your food. So hopefully that's helpful. All right, I am going to sign off. Bruits in the neck are related to carotid atherosclerosis. Check out the vascular disease video I've done on YouTube as well. Best way to stop using metformin: talk with your doctor and use a ketogenic diet. I've talked about that, Raymond. Go back and watch the first part of the video. I talked about that extensively, so go back and watch the first part. Marisol, thank you. I appreciate you being on here a lot. You're one of my great fans. I appreciate it. I'm going to watch YouTube videos. Oh, Sheena, thank you. Somebody plug in there. Well, I can plug it in here. It's youtube.com/Dr. Nally. And I'll show this up here on the screen so you can see. This is where my YouTube videos are all at. You can go there and watch them. And hopefully that gives you guys some benefit. Hello from Australia. You just tuned in. Watch the replay. Oh, please do. As soon as I finish this, I'm going to try to upload this to YouTube. It takes about 30 minutes to an hour to get it uploaded and put on there, but it should be there hopefully in the next hour or two. Even doing this in a hotel room here in Austin, Texas. Let's see. One last question. Cathy says, I have gotten the ketosis strips to check urine and it never shows me in ketosis. All right, Cathy, I've said this thousands of times and I'm going to say it 1,001 and probably 2,001 before I die. The urine test strips are only effective for the first 1 to 2 months. After the second month, they're worthless because your body conserves ketones and it tries not to spill them because you're using it as fuel. The body's pretty smart. It says, hey, I don't want to lose that. I want to hang on to that. So since you're not using glucose, it's going to hang on to those ketones and it's going to stop dumping the excess ketone into the urine after the second month. So the urine test strips are worthless. If you want a good one, get it like Keto Mojo or Abbott's testers. I actually do I have them here with me. Oh, no, they're in my bag. I've got my glucose monitor and my ketone monitor that I carry with me everywhere I go, and I check my numbers in the blood, not the urine. The urine is worthless for most people after 2 months. So check that out. If you go to my website, docmuscles.com, you can click on the Keto Mojo link, and that's the one I like. It actually does glucose and ketones together. My battery in that one died, and so I'm carrying the two separate ones I have right now. In fact, I'm at the conference, so I can get another Keto Mojo. That's one of the reasons I came, so I could buy a new monitor. So anyway, that's the story. You guys have a great evening. I appreciate you guys signing on, and share this out if you got a family member, or a friend member, or a friend who you think will benefit from it. And then share out the link to YouTube for me so we can get people watching it. And then if you're here at KetoCon, come see me and say hello, and I want to shake your hand. I want to hear your story. You guys have a great night. Remember, keep the fat high, keep the carbs low, and you keep asterifying. And if you don't know what that means, check out my previous videos because we talk about that. Have a good night, guys. Take care. Bye-bye.